There's self-evaluation by the service providers, and then we have an interface meeting. So what it means is that when we gather the issues, we have to show the issues to the service providers. Then they will evaluate themselves. Then we now come back to sit with them to address their problems. So those are the steps, and the steps are also explained in this diagram. So you see that the preparatory work is what is the dominant point. The community now comes together, everyone says, okay, this is the problem I've seen, this is the problem I've seen, and all that. Then, at that level, you can divide yourself into focus groups, and then you can outline the information and talk about what are the issues. Is it budget issues? Then you can develop your input indicators. The indicators are the specific issues that would come out from your focus group discussion. And then you can collect your evidence on those issues, and then you can put them down, record that data. And then when you do that, you also give this information to the service providers. That's where they do their performance scorecard. Then they will evaluate themselves. They also follow the same processes, and then they also develop indicators. And then you now come together to do the interface meeting. At the interface meeting, that is where you and the service providers are discussing the solutions to the problems you have identified. And what do you do after that? You all get the feedback, there is dialogue among you, and there is feedback, there is transparency in the end from the service provider and from your own ends. And then there are reforms, and then you try to join together, and then you make reforms. What are we doing to change this? What are we doing to change this? Then you do that together. And when all this happens, what it means is that there will be efficiency in the service that will be delivered to you, because you are part of the process. You have identified the problem together. You have reasoned the solutions together. And so there will be efficiency in the service that will be delivered to you.
If I could go back, if go more light on the information on entitlements in budget, and then develop indicators. Practically, sign and distance. Give examples.
So information on entitlements means what are you entitled to?
Okay, let's say the chief's campaign.
So you need that information. So if it is okay, the chief's compounds already exist. In terms of the services, what are you entitled to? So you need to gather that information. And then is there money available for that? You need that information. You understand? And then you said developing the input indicators. So when you identify the issues about what you are entitled to, what are the problems? What are the reasons why that those things are not happening? And what are the gaps in that particular services? The specific issues.
So for instance, maybe they don't have medicine.
Yes.
That is still as
so lack of drugs could be the specific
indicator.
Yes, it is an input indicator. So you would have identified lack of drugs. But it's your entitlement. Any other issue before we move to the next slide? Okay, how does the methodology work? So this is how the methodology works. Input tracking, then we have the performance scorecard by the community, then we have the service provider evaluation, then we have the interface meeting, and there is follow-up. So we've explained this a couple of times. You gather your information, you do your scorecard, the service provider also do their own evaluation, and then you use these two to come together, interface with, sit down and discuss, you, the community, and then the service provider. Then what happens next is follow up, because you have agreed on specific solutions. How? So if you agree on specific timelines, so if you agree, for instance, by next week, there will be drugs. You don't just sit and assume that next week there's drugs. You have to follow up to be sure there are actually drugs, and if there are drugs, is there a quantity or what is available adequate enough to meet your needs? You need to go back to the facility and check this.
So, there are no instances where the service providers scorecard differs from the scorecard by the community. What happens?
So that is why you would always need the evidence. So when you are confronting people with the evidence, there is no way they can escape. So for them, you are confronting them with the evidence, and they are using that to evaluate themselves. Is it true there are no drugs? They will agree, yes, no, they know. Especially if you are going there with the evidence that there are no drugs. You understand? So for instance, the evaluation I cited in the Nalerigu municipality, when we met the community members and then the chief's compound, the health management committee and everybody, we presented the findings to them. This was a study we conducted, we got those findings. And when we presented the findings to them, well, the community, the health service provider, everyone agreed. He said, this is our problem, this is true, your findings are true. You understand? So when you don't gather the evidence, well, they can always so for instance, if you don't have evidence that there are no drugs, then you go and present your scorecard to them that there are no drugs. Then they ask you, what's your evidence that there are no drugs? What are you going to do? So even if they are coming with their scorecard, they come to say there are drugs because you don't have evidence. So you always need the evidence to confront them. All right. Okay. So any other issue on this specific one? Are we good to go? Okay. So the input tracking. So that's why you gather your information on the expected quality and quantity of the factor inputs. Input tracking. You know, I said this is very important. It's the beginning point of it all. So that's where you gather all your information. And then you can look at the expected quality or quantity of those areas you want to. So for instance, health workers. Are the health workers enough for that facility? So one of the issues, for example, again, that came up in our study in that particular health facility I'm talking about was the inadequate nurses or health workers in that facility. So what we did was to look at the Ghana Health Service standard in terms of nurse-patient ratio. Then we look at in the community what that the ratio looks like. Then we realize that, okay, when we compare this, then it means that what they have at the facility was woefully inadequate. So when we are confronting them with this evidence, what we tell them is, this is what the Ghana Health Service requires. This is their standard, but this is what your community has. The facility cannot deny this. You understand? So you gather that evidence, and if you don't gather the evidence, then you will confront them, you are in trouble. So drugs, infrastructure, is it enough? Equipment, medical equipment, is it enough? So it was also an issue that featured in our study. The medical equipment, what they had was is it BP? Is it BP apparatus? Those the one they tie around your arm and then they pump it. Is it the BP apparatus? So they didn't have enough equipment, and then we noted it. And what we did was to send somebody to engage the facility. Ask them questions. Do you have this? How many? What's the number? So assuming assemblyman. When we went through the assemblyman. The person who went to take the data went through the assemblyman. So they went and informed the assemblyman. The assemblyman called the facility. Then they also went through the Ghana Welfare Service and the municipal directorate. So they informed them. They know. So they also call the facility. Some people want to come and engage you and collect some information. If you don't build this kind of partnerships, then the facility might even deny you the information. But if it is you are going that there in the name of assemblyman or in the name of the health service, and that is why it's important for you to go there in your networks. So that there is some power. You understand? Yes. And so this is how the matrix looks like. So you would just what is the entitlement?
Sir, please, I want to ask a question. Yes. In case I'm in charge of health management committee. So it got to a time that our facility would not have the drugs, and we made a follow-up to the district health director. He told us that he would provide us drugs. Always we are going there and we are not getting. So in short, what can we do?
So you don't work alone at this point. This is where you will need the unit committee, you will need the women VSLAs. You know the women patronize the chief's compound most. So if they add their voice, and then you mobilize yourselves, you are speaking in one voice. But if you are speaking as a health management committee alone, you continue to get the same responses, promises upon promises upon promises, but you are not going to get results. But when you are doing that in the name of a network, coming together, working together as a community, that one, they surely will listen to you. And maybe also, when you go there, you don't present evidence. That's also a problem. But I think the most important thing is working together, having a collective voice.
But we went there with our chief, so he was also.
Well, sometimes the chief also understands the political language. So once they say, chief, please go, to happen, we'll supply the drugs. Oh, he will understand that. So this way is also good. But let the chief be in the house. Work in the network, inform the chief. This is the problem, but this is the steps we are taking. Let him rest in the house. But you need their blessing. And sometimes the politicians, when they speak to the chiefs just know, oh, this one is intimate. They are part of me. They are under. So once just listen and so this is how the matrix will look like. So you need to state health workers what's their entitlement. So like I stated, Ghana Health Service says the next patient ratio should be this. You understand? Is it the reality? If it's not, what is the actual thing? Then you want your remark. So you say inadequate. Then you list them that way. Is it infrastructure? Is it working hours? Do the nurses or the health service providers, do they come to work at the time they should be coming? What does the Ghana Health Service or government require of them? Is it the same time they come? Is it the same time they leave? You mark, not on time. That's your remark. When you do it this way, you would have collected the data at that point. Are we together? Great.
Can we start with a listen like from the patient in the hospital? If it's about the drugs, you don't want to go straight to the listen like the health workers or the doctor, but you start with the patient in the hospital. Ask whether when you came, were they able to give you this drug, or were they able to treat you this way?
So let me give an example again of the study we conducted. What happened was that we also measured postnatal, antenatal, and all that, those services. We would try to understand what were the efficiency or effectiveness of those services. And with that one, we didn't go to the health facility. We engaged the community members, yes, who were the pregnant women in the community who were going there. You understand? So there are some of the indicators. You don't need to go to the facility. You need to speak to the patients themselves. Aha. You understand? All right. Okay.
You've indicated and understood people well. Normally, we the media, we have a time given to the doctors and the nurses to educate us about our health. At times, you will be having information. So our ability when they come, and we know that these are the challenges that they have. We throw the person out to know the truth of the matter. I can remember one time there was a problem. Those who go for pregnant women, they will be demanding some talking from them for common medicine. Something that is 2 CD, 3 CD, the facility cannot provide. So I threw a question to the doctor to explain the reason why at times they will walk to the hospital and then they will now send them to go for the gas, which is very wrong. And then he admitted that at times the gas freeze and then they have to talk to them to go for the work by. So it's good for us to ask and then know more. Thanks very much.
So you see that the scenario he just explained, this is where the community scorecard is important. So they have identified the issue, they have gathered the evidence, and then they have invited the service provider to answer. And so the service provider comes, and then they admit that the evidence they were holding is true. But at that point, it wasn't the community discussing with the service provider, how do we solve it then? You understand? So that's why the scorecard is very important. And I think that, yes, our media friends, we can always help our communities with this. So now that you know how the community scorecard works, I think that when you gather the evidence, you can involve our communities. You can invite. So you can even, I don't know if this is the best practice to make the scorecard hearing public. So not coverage on radio.
Yeah. So for example, CNN will do a town hall and focus on discussion. After maybe they have the election, then they're going to take undecided votes and just put them and so assess the debate. Has it changed your mind now? Have you influenced you? Our media should begin to do something like that. You can just go, instead of speaking of them, if the commission go together, who are directly benefiting from the service, they say, like, let's go together. And then all you do is that give them a mic. And their voice, it's not your voice. I think that way is better, like you divorce yourself from the issue. All you are doing is giving them a platform for them to amplify. In a very simple way. But I think if we do that, it's better.
So our media friends, I think that this time around, no excuse will help us to help our communities. So that we are solving the problems together with the service providers. And not just the service provider come and sit and then talk and then go, and the problem is still there. So I think that this time we can begin to engage the communities. You can do live broadcasts of the engagements, and it will help the community a lot. And I think it also helps for other communities who have similar problems. When they hear the processes, they can also begin to kind of implement these approaches. And I think you should help us on this one. So this is just a pictorial example of how these things are done. So you have your women group, focus group, they are sitting together to discuss. And this is a service provider, they are also sitting together to discuss what are the issues and all that. So at the end of it all, then you come together. Yes. So by the community, so when you do your indicators, when you harvest your indicators, this is the next step. You now score that. You see that the first one, the information is taken. This is where you now score. So what is the issue? Lack of drugs. What was the situation? Was it bad? Was it satisfactory? Was it good? What are the explanations? Great health workers. What's the situation? Is it bad? Is it satisfactory? Is it good? And you explain. You understand? Any issues?
I will suggest that as indicated, the slides are images.
Definitely.
Then these tables are not like blank.
Yes.
They are filled with EG. Like they are constructed.
Okay. So what we will do is, when you have your breakout sessions, we'll use the issues you have identified as examples to populate these tables and then share the slides with you.
Very nice.
Are you good with that? Yes. Okay. So are we good to go? So this is the third step. We already said that the service provider needs to do an evaluation of their own services. Yes. And this is how their evaluation would also look like. And I think, unfortunately, my people did not win that project. The evaluation, we used the finance to apply for a project. And one of the issues was to strengthen relationship between service providers and their clients. Some bad attitude coming from. So we said, okay, if they have this bad attitude, can we train them on how they can treat their clients in terms of building stronger relationship with their clients? So they will evaluate, they will tell if their attitude is also affecting the work they do, or management of the facilities, and sometimes they're in charge, is just something else. So they will also do this evaluation, and then they will present this to us. So our information, their own evaluation, we bring it together. Then we now say, okay, these are the issues. So how do we solve it together? Then you are dialogue, community service provider, you dialogue and you solve the problems. Then you give timelines. Okay, from this time to this time, we'll solve this one. From this time to this time, we'll solve this one. And in that way, it's going on very well. I just pray and hope this gets into the report. We were able to work with the community where the chief's compound was evaluated to connect them with a charity organization that will provide the facility with health equipment. Yes. So it was at the community engagement we did all these discussions. So these are the issues. Community, let's not leave everything to Ghana Health Service. What can we do? We are NGO together. What can we do? Then the suggestions were coming. Then somebody suggested that, oh, but you are an NGO, maybe there are other NGOs who are working in the field of health and then they can help us to solve some of these problems. Quickly, an NGO came to my mind. Then I texted the director there. Director, has your container for this year arrived? He said yes. I said, when is the next container? He says, by February. I said, okay, this is fine. Then I texted to find out again, is it possible we can get some support for a health facility in the next container that you are importing? I said, why not? That was the answer, why not? Then I quickly rose up and said, this is good news. We are connecting you with an NGO to help you solve this particular problem. So after the meeting, the assemblyman came, the health management committee, we wrote a letter, the district assembly, the PM signed, the assemblyman signed, the health management committee signed, then they all signed, then we sent it to that NGO. So we have applied, by February they get the equipment. So that's how the problems are solved. We sit together, we talk. Sometimes they are also overwhelmed, lack of resources here and there. So you cannot leave all the problems to them. We belong to churches, we belong to mosques and all that. Sometimes the problem is that they don't have wash facilities at the facility. Our charity organizations for the mosques and all the churches, they go to the communities and construct these wash facilities here and there. Can't we go to our church and talk to pastor and say, Pastor, this is a problem, and I think you can help us. So sometimes that's how we solve the problem. And when we do, you will realize that because the community owns the process, the service provider will never misbehave again. So that's how it should be. Are we together? All right.